Hi guys, I wanted to share my experience with you having wisdom teeth cavitation surgery. I just had all four of my wisdom teeth sockets cleaned out. When I was 23, I had my wisdom teeth removed, and now at age 37, I went and had the infection cleaned out. So if you are watching this, you might kind of be either considering getting this surgery or just kind of scratching the surface of what this is all about. But basically, cavitations are a hole in your bone, in your jaw, where a tooth has been removed and that bone doesn't regrow, so it creates an infection. And unfortunately, we cannot feel this infection. It doesn't create any swelling or any pain, but it does drain to the rest of your body, whatever kind of pathogens end up in this area. So, a lot of dentists do not recognize or admit that cavitations are a real thing, which is interesting to me because number one, I'm going to show you my pathogen report of what came back in all the samples in my cavitations. And also because if you just think it through, what do you think happens over years and years and years of a hole in your jaw that is wet, warm, and dark? It is the perfect breeding ground for bacteria. So, the fact that Western dentists don't recognize it is a little bit sad to me because it tells me they're not thinking it through, number one, and they're denying some really interesting scientific data that's been coming out. And that's how I got on this tip. I actually watched The Root Cause about 6 months ago, and that is all about how the relationship between what's going on in your mouth and your body and what is caused by modern dentistry. We're constantly pulling out teeth, doing root canals, doing metal fillings. All of these things have implications in the body. And in my practice, personally, I deal with a lot of thyroid issues, a lot of pathogenic infection, and a lot of times, not always, but a lot of times I can find a root cause being an infected root canal or, socket somewhere, something that's happened in the mouth that is affecting the rest of the body, especially with heavy metal toxicity and thyroid stuff. It's just been a thing that I've been realizing in my practice. And so I was really curious after watching The Root Cause if I had cavitations. So this is not something that you can see on a regular x-ray. You have to get a cone beam CAT scan, and that's actually something that measures bone density. Now, in my situation, you could tell that it was a little less dense, but it wasn't gapingly obvious. I have seen some scans where it's like you can see a black hole or a cyst or something, and it's a little more obvious. At that point, people tend to already be pretty sick. I wasn't sick. I wasn't having any symptoms or side effects of any sort. I just was curious if I had this in my mouth and wanted it taken out. So then I went on this whole quest trying to find a holistic dentist, and what I found was that a lot of dentists claim to be holistic and they're not. They might do a couple things holistic, but not really the whole shebang. So I want to tell you guys what you need to look for if you want a real holistic dentist. So a real holistic dentist is going to recommend that you do colonics with rectal ozone twice before your surgery and once post-surgery, and that is because we want to work on the integrity and the health of the microbiome. When we're opening up an infection, we want to make sure the immune system is ready and we have a lot of pathogens out of the gut as far as the negative pathogens. You will also want to do 2 ozone IVs with 10,000 milligrams of vitamin C before the surgery and 1 post. The reason is because we want as our blood to be as clean as possible, and that's because we're doing PRF during the surgery, which brings me to my next point. This stands for platelet-rich fibrin. So when you're at the dentist before the surgery, they'll take your blood, they'll spin it out in a centrifuge, and they actually take the plasma and it will go back in to the sockets to help heal the bone. A holistic dentist will clean it out with a laser and with real ozone, and they will also use something called bone graft. I was awake during my surgery, which I'll go over as well. So everything the dentist was doing, I was like, what is that? Let me see that. What's going on? So she actually let me touch some of the bone graft, and it's kind of like a sandy, wet material that just has calcium and other minerals in it that bone is made of. So basically, when you're getting ready for the surgery, you're doing your colonics and your IVs. I also recommend no sugar a week before and a month after your surgery. You want to increase all the good for you fiber rich foods. So fruits, vegetables, beans, legumes, organic whole grains. You want to keep out the junk. It's really important when you're healing that you're not doing inflammatory things and things that feed pathogens. So you're doing your colonics, you're doing your IVs. A truly holistic dentist will not recommend antibiotics, and also no drugs and no gas. There is no reason that you need to be under for this surgery because it's very gentle on the body if the dentist is using all of these things. So I was awake the whole time, no gas. Gas is actually really hard for the liver to detox, especially if you have the MTHFR gene mutation. But my dentist just had these frequency things on my ears. So I did oxygen first and then ozone. So I was very relaxed. Obviously they numb you, and she also gave me some homeopathic things. So I didn't really feel anything that was going on. I will tell you, when she would each area that she would open up, the blood that came out tasted so disgusting. It did not taste like fresh blood, like when you nick your finger and you put your finger in your mouth with the cut. This was the most disgusting tasting, rancid blood. I could just tell that it was not healthy. So they're going to clean out the area. They go through it with the laser. If you had there's a ligament below every tooth. If it wasn't properly removed by your dentist, which 9 out of 10 times it's not, whoever did the original surgery, they will remove it. They'll clean it out with the laser. They'll clean it out with the ozone. They'll put the PRF in there. They'll put the bone graft. They'll put a little barrier on it. They will stitch it up. And I drove myself there and drove myself home. I literally had 0 swelling and no bruising. I'm not even kidding you guys. And it's because of the PRF and the ozone and all these beautiful anti-inflammatory and healing things we're doing. The importance of doing all these things is so that the bone actually grows back to a solid mass so that you don't have a hole in it anymore that could, get another infection, and you have to do this down the line. So really, when I look back at my original wisdom teeth surgery, it was miserable. I had the gas. I was in there for hours. I was swollen like a chipmunk. This was just not that experience. I'm telling you guys, 0 swelling. So if you are considering doing this, please make sure that you are doing all the things that I just said and that your dentist is doing all those things so you have the absolute best outcome possible, because we don't want the risk of having another infection down the line. So speaking of infection, I'm going to go ahead and pull up the chart. This is the test of the samples that were taken out of this was the most infected cavitation of mine. So for any dentist that tells you that cavitations are not real, you can go ahead and show him this little lab report. So anything above a 9 is severely out of balance, considered dangerous amounts. As you can see, I have strep, I have the P. acnes bacteria, and I'm probably going to botch this Campylobacter bacteria. And as you can see, that one was the most offensive. It's over 50 and it's almost off the chart. So the danger with this bacteria being in your mouth and you not feeling it, right, is that every one of these teeth has a blood supply still. This is why it doesn't swell. It just works on this infection and it just washes it out to whatever meridian that tooth is on. So your wisdom teeth are on your heart meridian. So I didn't want bacteria, going down and draining to my heart meridian. That's very dangerous. Another big thing to consider with this is, or just in general with using a holistic dentist, is when you're getting amalgam removed or when you're getting a root canal. This is not just for wisdom teeth. This is anytime a hole is going to be left in your jaw. So a tooth is removed, they have to drill whatever. They need to do all of these things to make sure that the bone is growing back. So in general, this surgery was a really great experience for me. It was easy. It was not cheap. It was about $6,000 for all 4 sites, which I think actually is kind of reasonable for, 4 sites of anything in the mouth. But it was a great recovery time. My mouth was definitely a little just sensitive to touch back there, like with food. You have to eat kind of mushy stuff for about 10 days and then no really rinsing until after 10 days, which I did use coconut oil with ozone in it, which you can get on Amazon. I also rinsed with, sea salt and water. I would do baking soda and water, just things to keep the mouth alkaline. So there's just a lot of great aftercare things you can do. Again, no sugar. Going back to the report of everything they pulled out of my mouth, I just want to kind of touch on germ theory versus terrain theory really fast. So Western medicine pretty much operates off of germ theory, which is this. If I have a virus or a bacteria, I have to somehow excrete it out of my bodily fluids and I can pass that to somebody else and then they get sick. In Eastern medicine, we are of the terrain theory mind, which is we recognize that our body has more germs in it than it does cells. I mean, we literally are walking full of germs and bacteria and viruses and all these things. So on our side of the fence, we recognize that when someone gets sick, under the weather, it's just that something is causing an imbalance where you have the bad guys kind of outweighing the good guys. Does that make sense? So in this scenario in my mouth, I had overgrown strep bacteria. I've never had strep in my life. I used to take care of my sick boyfriend all the time with strep. I never got it once. The fact that I had a hole closed in my mouth that for over, I don't know, I can't do math, 12 years, the last 12 years, that grew with strep bacteria. I didn't go catching strep bacteria that whittled its way into my socket. No, my terrain became favorable for that kind of bacteria to grow, and so that bacteria took over. So from my point of view, strep throat and just getting overgrown strep is just an overgrowing of that bacteria in the throat because something is not healthy in the throat and mouth tissue, not necessarily because you catch it. Now, that's not to say that you can't get strep from somebody else. I've certainly, heard cases of people getting strep, but sometimes if you think about it a little bit differently, like if the kids get strep in a family, well, maybe it's because the kids are eating the same water and eating the same diet, drinking the same water, exposed to the same things, to the point where it made an unhealthy environment in their mouth where the strep became overgrown. So just with all the crazy things going on right now, that's kind of a food for thought for you guys. There are things that cause our body to go out of balance and cause our terrain to not be as friendly as it could be, which would make the bad bacteria or give them an opportunity to grow. But we already have all this bacteria in us, you guys. We already have and make all the bacteria that test on these tests that make us sick. These are all already things that are within our body. This is true. So that's just a little food for thought for you. So definitely recommend seeing the root cause if you have not already. I really hope that you guys found my story valuable to you, and good luck with your cavitations. Thank you so much for listening.